Good morning, everybody. My name is Adriana Gomez. I'm the Executive Director of TeamSmart International, and it's an honor to be here, sharing with you about Joven Salud. Did you know that there are 6 risk behaviors that contribute to 75% of the cost of the illness and death among adolescents? These are violence, including self-inflicted and accidents, tobacco, alcohol, and drugs consumption, sexual risky behaviors, lack of exercise, and poor nutrition. According to literature, these are preventable and they are closer together. It is alarming that in Latin America, interpersonal violence is the cause of 41% of death among male teens, and that 1 out of 7 youth are experiencing mental health disorders like anxiety and depression. Jovensalud.net is the online platform and a mobile application by TeamSmart International. It provides information, health promotion, and accompaniment to teens 10 to 24 years old. And it has been constructed based on the framework of the health belief model that suggests that when teens feel empowered, motivated, and well-informed, they will make healthy decisions for their lives. You can think about the online platform like a virtual hub for teens. All they have to do is register online and they get free access to several services. For example, health questionnaires where they can assess the level of risk and protection factors that they have in their lives. We have online coaching or counseling. We have virtual courses about life skills. We also have micro messages, forums, and this year in 2023, we launched gamification, which is an educational methodology that looks like a video game inside the platform. Even though governments and private sector are making internet more accessible geographically and economically, the truth is that there are huge gaps still. So that's why alliances are so important. We have partnerships with more than 100 schools and NGOs throughout Central America and Mexico that uses our services as a complement of what they are doing, and also provide digital devices and internet access to the teens. I'm going to show you an example of what we did in Costa Rica as an example of a partnership with the government and other sectors. We were part of the Mesoamerican Health Initiative that aims to reduce teen pregnancy and also to support teenage moms. And they introduced a counseling service, a face-to-face counseling service in the community health centers, or EVAIs, as we call them in Costa Rica. But they experienced the problem that several teenage moms couldn't commute to the health centers. And so we complement what they were doing with our coaching, online coaching for them. So let's hear a story.
Tengo una hija, una bebé de 1 año y 6 meses, se llama Fiorella. Sí me sentí juzgada porque, bueno, cuando yo salí embarazada, que fue a los 16, muchos ya me volteaban a ver con otros ojos de que, ay, pero usted tan pequeña, que ya arruinó sus estudios, y un poco de pensamientos negativos. Y bueno, Joven Salud me ha ayudado con mi hija, ya que tal vez pensaba cosas negativas sobre mí, mi cuerpo. Me ha ayudado también a saber llevar la relación con la bebé, conmigo, sentirme bien conmigo misma, no sentirme insegura. En mi familia me ha ayudado en eso, a tratar de hablar más con ellos, tal vez si me siento mal, dialogar con mis padres que me den consejos, o también si no puedo con ellos, ahí está el programa Buscar Consejo para que me guíen también. Yo les hago consultas sobre mí, mi cuerpo, mi salud, y ellos me brindan apoyo, tal vez que no tengo. Y he optado por preguntarle a ellos, ya que, no sé, siento como que más seguridad y tal vez siento miedo al preguntarle a familiares o algo así que me vayan a dar la espalda o regañar, tal vez.
So far, 130,000 teens has been used Joven Salud. They are coming from 19 countries. And we are tracking the use, satisfaction, and impact of our interventions. You can read there in the slide some of the examples of the impact that we have been making. For example, in the case of Natalia, she mentioned the improved family communication, which is very important for us. So this is our track record. However, the pandemic has shown us that the need is enormous, and we know how important it is to scale these services. There are 70 million teens from 10 to 24 years old only in Central America and Mexico alone, and we want to reach them all. This is why we put together a scalability plan, and we have some supporters, and we're still looking for heavy lifters to make this possible. We want to reach 1 million teens before the decade ends. We identify some areas, specific areas for scalability that we think is important to lift in order to scale. And as I told you, the pandemic has shown us that the need is urgent, the time is now, and it is us, the ones who are called to help. We need you as supporters, as promoters, and advocates in front of health ministries, education ministries. So please join us in this inspiring journey of empowering the future. Thank you very much.